Welcome to the UNCG MSAT Continuing Education module on evidence-based practice. This is part 6, evidence-based practice at UNCG. Please complete all 10 parts in the quiz that follows to receive your CEUs. Let's begin. In the previous parts, we have talked about the basic foundations and fundamental principles of evidence-based practice. In the previous section, we used an example from the literature illustrating how evidence-based practice can be used and critically analyzed. In this section, we're going to be talking about the concept and the principles behind evidence-based practice using Sackett's model. The basic model of evidence-based practice takes into account three major aspects. The first aspect, which we've been talking about, is using the best evidence available. This is using sensitivity, specificity values, likelihood ratios to determine if the evidence is worth considering when looking at a clinical test. The other two components is the knowledge and expertise of the clinician and the patient's values and preferences. As a preceptor, we rely heavily on your input in this section. Your knowledge, your experience, and your work in the field is crucial to the overall concept of evidence-based practice. In addition, you provide input as to what patients typically prefer, don't prefer, and their values when it comes to different clinical exams. One thing you'll notice with many UNCG students is that they will get so caught up in the evidence that they will ignore these two components. It is crucial as preceptors that you educate them that all three components play a part in the ultimate clinical decision. We teach our students at UNCG that we want the evidence to guide our clinical decisions, but we need to remember other two components are important and cannot be discounted. As we move through the next sections, we will go through individual body parts, illustrating one or two clinical or special tests that we use, that we feel our students should use in their clinical settings. These tests are using the best available evidence in the literature. Hopefully, as you go through the following sections, you can use the evidence as well as your own experience and what you see to patients and can help the students make an educated, informed, and appropriate clinical decision.